So as we discussed last time, there are 6 major points that you want to address, but then I want to add a few things to if the patient comes in with, let's say, different scenarios. Let's say you have, neck pain, shoulder pain. If it's going to be a chair massage, most of the conditions that they're going to be coming in for that we can actually do, the stress relief program, it's going to be mostly the neck and the upper back. Yes. For me, I would like to ask a patient, okay, what are you suffering from? Do you have neck pain or shoulder pain? Or if it's gonna be, a thoracic pain, or generally if it's just, oh, I'm just stressed, I'm just tight, okay? So it can be one of those, right? Or if it's a lower back pain, we can do something, but then we have to go from this area here.
So you would
which
go
I'll show you.
from
No, it's
down?
going to be specific conditions only, because remember, it's a 15-minute session.
Yeah.
All right, and recapping from last time, the technique that you're going to use will be, you're going to have more or less 1 minute of cross friction, right? More or less 1 minute, you hold it, you're doing it like a trigger point release, and then 1 minute you're kind of doing a quick stretch. You usually don't do a 1 minute hold on the stretch anyway, so you may actually sometimes, depending on how the flow is, you may be spending a little more time with the other techniques. So that all depends, that goes depending on how you're doing it already. But if it's 15 minutes and you're doing kind of like 3 minutes each part, so you kind of have, like if you're doing 2 sides, so you kind of have like maybe around 5 points that you can actually work on. And if it's gonna be left and right side, it's gonna be 3 points here, and if you do 3 points here, that's 6 points. You're gonna be going past, you go past a minute or two, that's not too bad, but you don't want to go too much longer. Okay, so those are the more or less the three techniques that you're gonna be applying for the patient when they have those, for each pressure point. Okay, now to recap there, what are the pressure points that we discussed last time?
Can I show it to her?
Yes.
I remember
All right.
it's one here.
What do you call that? So that's, if it's up here, that's called the levator.
Levator.
Yes.
And then I remember there's one under right by here. I forgot the names to be
Okay,
honest.
so you guys have to be familiar with the naming.
So this is the levator.
So let's say from up going down, this is levator. Okay. Then here you have the upper traps.
Upper traps.
It's very common. Okay. And then if it's shoulder problem, then we'll have here in the front part.
Pectoral.
Yep, it's gonna be the pecs, right? The pectoral minor. And then if it's gonna be here, you have, this is the shoulder blade.
Right.
The inside part of the shoulder blade. That's your rhomboids, right?
Rhomboids.
And then you have, if your shoulder blade is here and you're gonna feel like there's a bone, kind of like usually it's horizontal this way. That's the infraspinatus there.
That's right here. What is it called?
Infraspinatus.
Infraspinatus.
Infra. Yes. Because supra, the spinatus means the spine.
Right.
This is the spine of the scapula. So infra is below, supra is above.
Okay.
Right, so this is infraspinatus. So that's 1, 2, you have 3, 4, and then the one we mentioned out. So we have the levator, you have upper traps, you have the rhomboid, the infraspinatus. Oh, the pecs minor is 5. And
just
then,
the pecs minor we're doing? Because then I
yes.
remember when we do a stretch, there's one like that we do,
Yes.
and then one
Well,
like
this one you just do. Basically, it's gonna be just a pec. Yeah, it's usually combined there already.
Oh,
so you're just
okay.
doing one, and then for lower back, we can add. Last time we mentioned that the psoas, but in sitting position you won't be able to do it. So it's a couple points that I want to add in this situation. So those are, in this case, the suboccipital.
Suboccipital?
Yes. The occiput is this part of your skull.
Okay.
So it's underneath it, so it's suboccipital. You try it yourself, it actually feels good when you press that.
Over here?
It's gonna be like up here. You see that space there? When you actually do that, it actually feels really good if they have a headache or something.
Okay.
So that's the suboccipital. And then if they have the lower back pain, let's say, you can do, it's a lumbosacral junction, so it's the muscles here on the side.
What is it called?
Lumbosacral.